Over the last 22 years, the main contributing factor that I've seen for implant failure is essentially inflammatory tissue and bone loss around the implant caused by foreign bodies. So if we catch the inflammation around implants, what we technically refer to as peri-implantitis, we can successfully manage that situation. If they're in jeopardy of losing that tooth, I'd like to see them come in before they lose the tooth to actually have that area evaluated. But if people don't replace missing teeth, we can have a myriad of issues happen. One, we have bone loss. And when we lose bone, that makes it very difficult to be able to restore that tooth. You can get closer to the nerve canal, you can get closer to the sinus, and it can really jeopardize that patient's ability to get implants, and they can have difficulty eating. The process which we normally take is evaluating the bone, evaluating the soft tissue, evaluating their bite, their dentition, how their teeth come together, and the space. By using the cone beam technology, the intraoral scan, the 3D technology, we're actually able to use a process that we call digital smile design, where actually we can show you ahead of time, real time, what your teeth can look like, predictability. And what I always like to say is we want to give people teeth that fit their face to improve patient outcomes and to give the patient a better result. Come in today for a dental implant consultation to design your smile.